Welcome back. Now, enlarged tonsils and adenoids are also referred to as tonsillitis and adenoiditis, or tonsil and adenoid hypertrophy. A child with enlarged tonsils and adenoids may have a sore throat, trouble swallowing, sleep apnea, or an inner ear infection. To understand what causes these conditions and how to go about treatment, we're joined now by general practitioner Dr. Nelson Makemba. Doctor, good evening. Always lovely having you here.
Good evening to you, Nina, and good evening to our viewers this evening.
Thank you so much for being here.
It's a pleasure.
I think, Doctor, a lot of people might know what tonsils and tonsillitis is, but what is adenoid hypertrophy?
Yeah, adenoids, by definition, are patches of tissues that are often found at the back of the nasal passage. Now, with recurrent infection from germs, particularly bacteria and viruses, especially in children, if these patches of tissues become overwhelmed by the infection, they tend to swell a bit. And that swelling is then what we refer to as adenoid hypertrophy.
Mm-hmm.
Yeah.
Is it similar to grommets? Is that what people would call grommets?
No, grommets is what we see oftentimes inserted by a ear, nose and throat specialist in the ears when the child has recurrent infection. Mm-hmm. And that tend to help, sort of ease that pressure in the inner ear.
Uh-huh.
Yeah.
Uh-huh. Talk to us, doctor, about how a child would develop, tonsillitis or adenoiditis.
Right. What tends to happen, like I've highlighted to you earlier, with recurrent infection, particularly from the bacteria, with the tonsils, you've got those oval-shaped pads of tissue at the back of the throat. Now, if they become overwhelmed by the infection, remember their function is primarily to help fight off the infection. But in the process of fighting off the infection, they themselves too get infected. And then once they are infected and they are swollen, then that's what we often refer to clinically as tonsillitis. The same is also with the adenoids when they get inflamed and swollen, and then it becomes adenoiditis. Mm-hmm. Yeah.
And when should a child then have these removed? Because I do also know that it's also recommended that you have your tonsils removed, preferably at a younger age as opposed to at an older age.
Yeah. With tonsils, really, if you get recurrent infection, that is at least in a cycle of 12 months, which is a year. If you do get at least up to 3 episodes of infection, that becomes an indication that that child qualifies to have a tonsillectomy, which is a surgical intervention where they are surgically removed. Mm-hmm. An infection that goes on to develop an abscess, peritonsillar abscess, or what we often refer to as quinsy, that also then becomes, an indication that that child qualifies to have the tonsils removed. And with the adenoids, because they can swell significantly, they interfere with breathing, like I highlighted to earlier in the definition. A child develops sleep apnea, they go to bed at night because the nasal passage at the back is swollen somewhat. They are not breathing properly, so they have to continually wake up in the middle of the night to catch their breath. And when the little one wakes up the next morning to go to school, they haven't slept properly, they are not focusing in class, they are sleeping, and they excessively snore at night. That also is an indication that perhaps, to have the adenoids removed, then you do what we call adenoidectomy. Yeah.
And would it be recommendable to remove, the tonsils before they become an issue? Would that be a wise thing to do?
Clinically, it's not necessarily a wise thing to do to remove them prophylactically, because most of the children that still have the adenoids and tonsils would rather go through their childhood life without having problems such as tonsillitis or adenoiditis. So the criteria to have them removed then becomes when they present with a problem, as we have highlighted to earlier. Removing them rather prophylactically is not a wise thing. Why? Because remember, they also help the child fight off infection. And if they are able to fight off the infection and they do not necessarily present as a problem themselves in the process, you rather, leave it, because it doesn't serve the child a purpose. But then if it becomes problematic, it's swelling up, there's an infection going on, there's an obstruction, the child is not sleeping very well, that then becomes an indication to say maybe surgical intervention is warranted.
Would there be any disadvantage to removing, tonsils or adenoids?
Yeah, I think complications can arise. I mean, through a surgical intervention, one can excessively bleed, for instance. That is a problem if it happens. It might happen, during the operation, a day or few days after the operation. You could have chronic throat pain, for instance, after they've been removed. While surgically removing them, surrounding tissues like the voice box can be damaged. The roof of, the mouth can be damaged. The teeth can be damaged as well. So these are some of the complications that can actually arise, and the breathing problems can actually develop. So there are certain complications that often might, develop post-operatively. But nevertheless, if one is under a care of a experienced clinician, or rather a specialist, ear, nose and throat specialist, oftentimes, the complications are rather meniscus. We don't really see it necessarily commonly.
Can adenoids grow back after they've been removed?
Very rarely. What might tend to happen, a situation where perhaps, when the surgical intervention has taken place, if all the tissue were not entirely removed, maybe there was some residual tissue that were left behind, you might see, that there's still a presence of adenoids there. But by far, if a complete resection and surgical removal of the adenoid has taken place, it's very rare that you see them coming up again.
Yeah. Lastly, what are the signs and symptoms of birth to look out for, doctor?
When children picks up, infections with the tonsils and adenoids, first and foremost, they might have this sore throat. They might have pain when swallowing. They generally unwell, the loss of appetite. They develop halitosis, which is a bad breath.
A fever?
A fever as well, that we tend to see commonly. Then obviously when they go to bed, particularly if the adenoids are excessively swollen, they snore a lot. And then they sleep apnea, where they don't sleep properly, and then you take them to school the next morning, the teacher is calling you saying your child is constantly sleeping in the class, unable to focus and concentrate. Yeah, these are some of the common presentations that we tend to see.
Doctor, thank you so much for joining us and educating us. Once again, lovely having you here.
It's always a pleasure being here. Thank you very much.
That was Dr. Makemba speaking to us there. We're going to take a very short break, and then it's time to talk to our